Good evening, everyone. You are welcome to today's facilitation class.
Thank you, Ma. Good evening, Ma.
Good evening. Welcome and thank you for joining. Today in our facilitation, in the week 3, last week we started module 2 and I mentioned that was part 1 or part A of module 2. That module 2 actually has 6 units under it. As a result of that, I have divided module 2 into 3 sessions. So we are going to be covering 3 sessions under module 2. And today in our week 3 is the second session. And what are we going to be discussing under part 2 of module 2, which is unit 3 and unit 4. We are simply going to be looking at occupational health accidents, occupational accidents, as well as occupation poisons. These are the 2 topics that we are going to be unpacking or deliberating or brainstorming together for the next 1 hour. And earlier on, I think yesterday, I posted instructional video on this topic to the school page, which I expected learners to have make out time to listen to it so that we can have an interactive session today. And so let me see in this session, in this class, who among you was able to download the instructional video and listen to it before now? Kindly put it on the chat. I was able to download it and I did listen to it. It is very important for us to go through the instructional video, not only the instructional video alone, but there are other materials or resources that are also uploaded in the e-library to help students. Remember, this is not a lecture, this is a facilitation. When we say facilitation, it's for me to guide students and not to spoon-feed students. In lecturing, I just pour the lecture or the topic, but this is a more student-centered learning. So the students are to go through the materials, then come up with areas that they are not clear, so that the facilitation makes it more clear in the class session. And so please don't limit your learning to this 1 hour facilitation. In fact, what makes this 1 hour interesting is for you to have earlier listened to the instructional video and read your course material so that we can all learn together. Remember that we are learning from each other. So I'll be expecting you to interact together, to interact with me this evening. So what do you understand by occupational accidents? Kindly put it. Okay, I'm listening.
Okay, Ma. Occupational accident is any injury that occurs at work, while someone is at work. Any injury, any discomfort, any ailment that occurs as a result of the person working, in the course of doing his or her job, he gets injured. I think that is occupational accident. unexpected happening that occurs when the person is working at work.
You are correct. You are correct. You are correct. And thank you for that attempt and that response. Thank you. Before we even go further, I would like us to have a WhatsApp group for this class so that outside this 1 hour class, we can interact together. You can ask me questions. I can also post announcements, reminder. So I will need someone to kindly be an admin of that WhatsApp. So if you are willing to take up that responsibility, kindly let me know so that we can set the ball rolling. You also had me so that we can have an effective communication even after our class session. So you are correct. Occupational accident is actually any injury. It is sudden, it is unexpected. You don't anticipate it. Event happened and you sustained trauma or injuries while you are on duty in your job place or in the job environment. This is an occupational accident. As much as accidents do happen, do you think we can reduce the risk of having accidents in the workplaces? If yes, what are the approach or strategies to prevent accidents at job places? That's a question I've just thrown to you. I need a feedback. I seriously crave your response, your interaction during this class.
So, Ima, you are asking what can be done to prevent occupational accidents?
Yes.
Okay. Yes, it's let me try. It's what you can do is ensuring that the workplace, in fact, you ensure safety at workplace safety by for instance, you avoid in fact you dispose of waste properly so people don't get to inhale them. You also ensure that surfaces are not that slippery, don't have that much of slippery surfaces, and then people should be protected with protective equipment. And then they should also, their health generally should be protected. How do you protect their health? By giving them a kind of protective, it's the same thing, protective personal protective equipment against any hazard.
Okay.
That's how I can go, ma.
All right, thank you, thank you, thank you. You've actually tried. Safety, it's very, very important. You have to provide a safety environment for workers. That is one way of preventing occupational hazard. Another way you've mentioned is providing a protective materials or devices. So when you're working in a construction company, it will be carelessness for you not to use your helmet. It will be carelessness for you not to put on your goggle because anything can slip and fall into your eyes. And so it is the responsibility of the employer to emphasize this. As a matter of fact, training employee before they start their job, it's very, very important. What do you do in training? You have to tell them the rules and the regulation, the policy and the guidelines of the company. When you do that and you let them understand there is a consequence when you sustain an injury and you are found that you are not using your protective devices. But of course, when an accident happens, it both affects the employer and the employee. How do you think that is possible? You would think that it's only the worker that will suffer, but the employer also suffer, because now the person, let's say, maybe the person that has sustained an accident is a production manager, or the one in charge of a machine that is producing something, and is the only guy that has been trained to operate that machine. When he sustained an accident, there is a kind of setback to the company. So that is why it's a two-way work. Both the employee and the employer has to ensure prevention and control of accidents in an industry. So that's it. So we've seen that prevention is very essential of accidents. You have to prevent it, provide a conducive or a clean or hygienic environment for workers, dispose of the waste, and chemicals should not be carelessly put for workers to inhale it. Disposing of the waste as well as the storage management of the company also should be very, very maintained and be in good order. So these are the ways in which we can actually prevent or reduce occupational hazard. I'm just going to quickly share with you a few points that I've put down on that. And before I share a few points, I also want us to understand that there is a learning goal for each week. That is, at the end of each week, learners are expected to be able to define or explain or describe. And so for that reason, the learning objectives or the learning outcomes for Unit 3 and 4 under Module 2, it's for learners at the end of today or at the end of this week facilitation. Learners should be able to define occupational accidents, occupational poison, and mention types of accidents in work environment, which we are going to enumerate shortly before we close. Also, we have predisposing factors to occupational accidents. Learners should be able to describe these predisposing factors, explain the methods of prevention and control of occupational accidents. Also be able to describe the management of accident cases in occupational settings. Describe occupational poisons and their sources, state prevention strategy for employees. So these are the learning objectives. These are the learning objectives And so I won't repeat myself or repeat what you have said about occupational accidents, because you've mentioned, you've defined it. Now, let's look at what can cause occupational or types. Let's look at the types of occupational accidents. Of course, it depends on the type of job or company you are working. You've seen that generally accidents are categorized based on types. What do we mean by types? Depending on what you sustained. And so for that reason, we have people who fall from a height. It's an accident. The person have fractures, dislocation, and sometimes some even pass away, depending on how high they fall from. Some, we have burns, high injury, wound punctures, sprain, motor accident for those who drive. We have some that is their work or to drive. Motor vehicle accident, some slip and fall, electrocutions, and so on and so forth. These are types of common occupational accidents. And so now I would like to share from you, to hear from you, what are the predisposing factors to this problem? Of course, as much as we want to prevent occupational accidents, we also have things that we can do to prevent, or things that are predisposing to it. And I've just itemized it in 4, or I've categorized it into 4. Where you have unsafe human behaviors. Like you earlier mentioned in your contribution, that when you don't put on your protective materials, then you are exposed. The environmental factors, the defective machine, the work characteristics, where there is less manpower and people are overworking, doing overtime and overtime. The body gets exhausted, and sometimes maybe you sleep or nap on duty and the machine is working, can cause an accident. And so all these are predisposing factors to occupational accidents. So I'm not going to go into details or explaining. That is why I've provided the instructional video earlier. But it's very important to understand that 80% of the occupational accidents that do occur are caused by human behavior or human failure as a result of psychological or attitudinal issues or factors such as anger, hatred, fear, anxiety, or even sometimes joy. So all this needs to be put in check. So far, we've mentioned prevention and control of occupational accidents. And don't forget, we may have a 5-minute or 10-minute quiz on this before we close the class. So take note: prevention and control of occupational accidents. Safe machines for workers by the employers. These are the ways. adequate training of workers on the proper and important use of safety devices, clear policy and guidelines on safety precautions for workers, as well as allowing minimal workspace for workers. And so let me stop sharing my screen and welcome your contribution on what we have covered so far, what you understood from this topic. So we've just finished Unit 3 under Module 2. Is everything clear so far?
Yes, I'm clear.
Okay, you are clear. But I also want to get your perspective. I know some of us are working in different industries, hospitals. You've got variety of experience, and this is the time to bring this course into it and see. Let it not just be theory alone, and that is one way by which you will easily remember in case this comes out in an exam. If you are able to relate it into your job, then it makes more sense. So I wouldn't want it to be pure abstract. Let it make it a kind of practical. How does it relate to what I'm doing, my job? Okay, and let's share from that perspective.
Okay, let me try something. For precipitating or predisposing factors for for occupational accidents, like for those of us that are working, okay, for instance, I work in a hospital. Okay, now unsafe human practices, human behaviors, like human failure. What is human failure? Human failure is, for instance, I work in a hospital and I'm exposed to a lot of health hazards from the patients, from even the hospital environment on its own, from contacts with the patients, even with the patient relatives. I'm exposed to a whole lot of hazards. Now, where I am failing as human, and this failure can lead to an accident, is where, number one, while dealing with the patient, for instance, I don't protect myself with gloves. I don't put on anything to prevent anything that spills or that splashes to come up to me. I don't protect. I don't wear a face mask. I don't wear a hand gloves. I just go to the patient directly and I attend to the patient. I could have a needle prick that could introduce a viral infection into my system, into my blood system, thereby polluting my blood. That is where human attitude comes in. And also, where I do not also put the sharps where they should be. Like in the hospital, we have sharps box. Where I do not put the sharps where they should be, chances are I could leave the needles that I've used, and then someone would prick, or I could also have a prick. From there, I will still have issues. And then where the environment I am working is not neat, it's not hygienic, a lot of things happen, a lot of microorganisms, they grow in there, they thrive in unhealthy environments, and then they give us a whole lot of, we even inhale them into our lungs, and they could also cause illnesses for us, even psychologically, So that's what I can gather.
All right, it really makes sense, you see, that we are able to relate this topic to our experience. And I like the way you brought the issue of protective materials, using it. Because if the hospital provides you with a safety device and you decide not to use it, and maybe the patient you are dealing with is maybe an HIV patient or hepatitis patient or Okay, we are in era of COVID now. Let's use the more recent pestilence. And you are dealing with a patient, and you are not wearing, you are aware that this patient is a COVID patient, and you know that this is very, very transmissive, and you are handling the patient without your mask, without your gown, your protective gown, without your glove. And at the end of the day, you contracted the disease. And not only you, you went back home and you have infected your family. That is really, really, really a problem. And it is because of the human failure. So when we understand this, we understand our role. The employers has their role, and we as workers or employee, we also have our own role as well. So it is important to understand this, and also it's also important also to understand the policy of the organizations you are working with. When we understand the policy, it also helps. And in addition, not only to understand, we must also have adequate understanding of the equipment we are working with. The equipment you are working with, you have to be knowledgeable about it. And so all this, if they are put in place, then we can reduce or prevent the chances of having accidents. So yeah, we move to Unit 4, which is occupational health poison. From the word, okay, before we even move, okay, because we are all nurses, so we are looking at it from the perspective of working in an hospital. What about those that are working in an industry? We are all familiar with asbestos, right? Those
Yes.
who are working there, we see that they are also exposed to a different types of accidents. And so those who work in a building or construction company, they are also liable to a different types of accidents. Those who do driving as a job is a different types of accident. So let's not be narrow in our view. Let's also have that in mind, that different industries have different industries do have what can cause an accident for their worker. But the whole aim, in case you and I are employed in an industry or in an organization, it is important to know how to prevent it. And another thing is having understanding about the pre-medical examination, where you have to understand the health status of who you are employing. That will enable employer to place the person in appropriate units where the health of the person will not be affected in terms of having an accident. Take for instance, someone who is having maybe a kind of frequent dizziness. When you employ such a person in an industry, you will expect that you will not put that person in charge of a machine. Because what can happen is operating the machine and it feels dizzy. It can either get affected, not even either. Chances are that such an individual will injure himself or will have an accident. And so it's also important. So we move quickly to occupational health poison. From the word poison, what do you understand by occupational health poisons, and who are at risk of having occupational health poisons? Let me share from your knowledge. Let me share from your knowledge what you understand by occupational health poison. Tell me, what is occupational health poison? Who are at risk of occupational health poison? How can we prevent it?
Let me still try. Let me still try. At first, a poison is any substance that when taken into the body, either in small amounts, no matter how minute or anyhow, is capable of causing harm to the body system. That's how I understand poison. And then occupational poison is a kind of exposure of workers to harmful substances. There could be chemical, there could be physical, it could be otherwise, that is capable of harming the system.
Yeah.
That's how I understand occupational poisoning. And then those at risk.
Okay, continue.
Okay, I said those at risk for occupational health poisons are those that are exposed to hazardous chemicals, that are exposed to those chemicals like asbestos and all these dangerous chemicals that are used in industrial processes. So those workers that are always working there, around there, exposed to those chemicals, they are prone to having occupational poisoning.
Yeah. Thank you for that contribution. You are right. You are right. And like you mentioned, poison can either be inhaled, absorb, or inject. You can inhale it. There are people that, like, when they are working in a company that produce these chemicals, when they inhale it, it affects their health. And sometimes it destroys the health so badly. But most of the time, because the effects are not seen instantaneously, people do not know the danger that they are being exposed to. And what do you mean by inject? How will one inject poison? People actually inject substance unknowingly. You have people who are working there and they're not using their hand gloves. You see them going to the canteen. They don't wash their hands. They've handled the chemicals and they're using the same hand. So all these are means of having occupational health poison. And so, example of these occupational health poisons, you have chemicals. And chemicals such as acid. We know how bad acid is. We have fumes, gas. All these are substances that can affect the health of a worker and can cause occupational health poison to the person. So quickly, Let me share what I think a few slides that I have on that. Before I share that slide, under unit 4, under unit 3, I forgot to mention that the management of an accident victim is very, very important. And it is important to let us know that an accident victim should not be moved from the accident scene until the ambulance arrived, unless the health or the life of the victim will be in further danger. That is when you move. And when you are moving, you have to establish that the breathing of the person and stabilize the person very well. You have to make sure that in carrying an accident victim, make sure you gently support the head, the neck, and the back, as well as the extremity, while trying to move an accident victim while waiting for the ambulance to come and convey the person where to get a treatment. So, like I was saying, that we've mentioned or we've defined what is poison and what is occupational poison. You mention it or you define it nicely. And we said that sources of industrial poisons, we have chemicals, we have metal for those who work in the company that produce lead. Lead is very, very poisonous, I mean. Strong acid, even dust, yes, those who work in the sawmill, yeah, those who work in the sawmill. So these are things that can cause poison to workers. What are the strategies to prevent occupational health poison? It's important to conduct a pre-employment and pre-placement health assessment. Monitor health status of employees from time to time by doing what? A periodic medical examination for workers. Effective supervision and inspection on industries. So you want to do a good supervision. It's very essential that most of us, you see, naturally, human being wants to do their own thing. So because of that, you have to constantly supervise your workers or those who are working around you to ensure that they are following all the precautions to prevent them from having occupational problems. Training is also important. You give them training at the beginning of their employment and also in-service training. In-service training is important. It's a reminder. It's a reminder of what needs to be done and how it should be done. And lastly, monitor the use of protective devices among employees. So far, that is implication. We have implication of occupational poisons. It can cause disabilities, psychological depression, psychological problem, depression, trauma, even economic loss, as well as social problems. All these are implications to having exposed to occupational poisons. So far, that is where we are going to end it today. But before we close, I want us to should we have quiz today? Should we make it next week? Or prepare for a quiz next week.